Hello everyone. Today we will discuss the radiological anatomy of the gastrointestinal tract and review the main imaging methods used in GI diagnostics. The gastrointestinal tract can be evaluated using different imaging methods. Each method provides specific information about anatomy and function. We will talk about main imaging modalities. There include X-ray, fluoroscopy, CT scan, MRI, endoscopy. Also, we use contrast agents with barium sulfate for X-ray or radiography, fluoroscopy, water-soluble contrast for CT scan and for fluoroscopy, for X-ray sometimes, and endoscopy. We will also review how the normal gastrointestinal tract appears on different imaging studies. Let's get started. First, radiography or X-ray. Radiography is one of the basic imaging methods used in gastrointestinal diagnostic. Abdominal radiographs are usually performed in the supine and upright positions and sometimes in the prone positions. On plain radiographs without contrast enhancement, soft tissue structures such as the stomach and intestines are poorly visualized, while bony structures are clearly visible. For better visualization of the gastrointestinal tract, contrast agents are often used. Fluoroscopy. Fluoroscopy is a dynamic imaging method that allows use to observe the gastrointestinal tract in real time. It is widely used for examination of the esophagus and upper GI tract, also for colon. This method helps evaluate swallowing, peristaltics, physiological narrowing, and structural abnormalities. Barium sulfate is the most commonly used contrast agent during fluoroscopy studies. Unlike static radiographs, fluoroscopy allows evaluation of both anatomy and function. Computed tomography or CT scan produces detailed cross-sectional and three-dimensional images of internal organs. CT is very useful for detecting inflammation, tumors, perforation, hemorrhage, obstruction, and other pathological changes. Contrast agents may also be used to improve visualization of the gastrointestinal tract and surrounding structures. Compared with radiography, CT provides much more anatomical details. MRI, magnetic resonance imaging, produce detailed images of soft tissues without using ionizing radiation. It is useful for evaluation of abdominal organs and soft tissue pathology. However, in routine gastrointestinal imaging, CT is used more frequently because it's faster and more widely available. In this topic, we will talk about radiological anatomy of the esophagus. The esophagus is a muscular tube that extends from the pharynx to the stomach through the mediastinum. Fluoroscopy and radiography of the esophagus. Usually we use fluoroscopy and radiography with barium sulfate. These studies help evaluate the contour of the esophagus, physiological constrictions, swallowing function, peristalsis, luminal narrowing. Fluoroscopy is especially useful because it allows use to evaluate both structures and movement during swallowing. In this image, you can visualize how we take fluoroscopy and patients in standing position, drinking barium sulfate. In one time when we take fluoroscopy, and we can visualize how barium sulfate swallowing through gastrointestinal tract especially esophagus. This is radiological anatomy or X-ray anatomy of esophagus, and you can visualize cervix esophagus in this image. Here you can visualize thoracic esophagus, and also esophagus have physiological narrowing. And this one is anatomy of esophagus in X-ray image, and esophagus start from epiglottica, and we have from epiglottica till esophagus stomach sphincter. And this one is lateral image of esophagus, and you should remember that esophagus placed in thoracic cavity near the aorta, halium, main bronchus, and spinal column, and that way esophagus have physiological narrowing. And CT and MRI of the esophagus. CT is not the primary method for routine evaluation of the esophagus because the normal esophagus is often difficult to visualize. However, CT becomes very useful in case of tumors, wall thickening, dilatation, or mediastinal involvement. MRI may also use in selected case, although it is less common than CT and fluoroscopy. And last one is endoscopy of the esophagus. Endoscopy is considered the gold standard for evaluation of the esophageal and upper gastrointestinal mucosa. During the procedure, a flexible endoscope is inserted through the oral cavity for direct visualization of the mucosa. The examination is usually performed in the left lateral position after fasting. Endoscopy is commonly used for mucosal evaluation, biopsy, direction of the lesions, and removal of foreign bodies, usually for children. This version sound in this image you can visualize mucosa of the esophagus, and we use endoscopy or we call it like gastroscopy, esophagoscopy, gastroscopy, and duodenoscopy, and we use endoscopy methods, and we take on time biopsy, and it's very high diagnostic methods. Other techniques we will discuss in next topic. See you. Thank you for your attention.